Most of us can enjoy eggs with our toast and a clear conscience, but for a specific slice of the population, that sunny yolk might come with a genetic rain cloud. Enter familial hypercholesterolemia, FH, a hereditary condition that dramatically alters how the body handles cholesterol. For those with FH, the usual dietary rules don't always apply, especially when it comes to cholesterol-rich foods like eggs. While the average person can eat eggs without sending their LDL cholesterol into orbit, individuals with FH may need to treat eggs with a bit more caution, if not outright suspicion. Familial hypercholesterolemia is a genetic disorder that affects about 1 in 250 people worldwide. It's caused by mutations in genes that regulate how LDL, the so-called bad cholesterol, is cleared from the bloodstream. Normally, LDL is removed by receptors in the liver that act like little garbage trucks, picking it up and keeping the streets, aka arteries, clean. But in people with FH, those receptors don't work properly, leading to high levels of LDL cholesterol from birth. This isn't a gentle rise over decades. We're talking cholesterol levels that can be 2 to 4 times higher than normal in children, teens, and adults. Because of this genetic glitch, people with FH are at a significantly higher risk of developing atherosclerosis, the buildup of plaque in arteries, and early heart disease, sometimes even before age 40, if untreated. And while dietary cholesterol has a modest effect on LDL levels in the general population, for people with FH, that same egg might pack a bigger punch. They're what scientists call hyperresponders, meaning their blood cholesterol levels rise significantly in response to foods rich in cholesterol. That doesn't mean an egg will send them straight to the ER, but it does mean that dietary guidelines for the average person don't quite apply. For most, 1 egg a day is just fine. But for someone with FH, especially those not yet on medication or with very high LDL levels, limiting foods high in dietary cholesterol may still be part of a prudent approach. This includes not only eggs but also organ meats, full-fat dairy, and certain shellfish. That said, context still matters. 1 egg occasionally, eaten as part of a largely plant-based, high-fiber, low-saturated fat diet, is different than daily bacon and egg breakfasts with buttered toast and cheese. Fiber-rich foods like oats, beans, fruits, and vegetables can help lower LDL, and plant sterols and stanols can compete with cholesterol for absorption, all of which are tools in the heart protective toolbox for someone with FH. There's also the important role of medication. Most people diagnosed with FH are prescribed statins or other cholesterol-lowering therapies, which dramatically reduce LDL levels regardless of diet. But that doesn't mean food doesn't matter. It just means food and medicine work together. Diet can't cure FH, but it can help manage the risk. And for people with FH who are well managed on medication and under the care of a cardiologist or a lipid specialist, a carefully considered amount of egg consumption might be perfectly acceptable, but it's always a personalized call. Genetics, in short, doesn't erase your freedom at the breakfast table, but it does change the terms of engagement. If you've inherited FH, your arteries are playing by different rules, and eggs, along with other cholesterol-rich foods, deserve a more tailored, cautious approach. For the rest of us, the egg is back in the good graces of science. But if your DNA says otherwise, it might be worth trading your scramble for a fiber-filled smoothie more often than not, and cracking your eggs only after checking in with your genes.